there, my name is Lauren Abdill. I'm an outpatient therapist at Relate Counseling Center, and I'm excited to talk to you all a little bit today about EMDR. EMDR, which is short for eye movement desensitization and reprocessing, is a popular evidence-based trauma treatment modality. So here's how EMDR works. Our brains are essentially split into two sides. We have the left side, or the logic side, which is where the logic functions of the brain are stored. And then we have the right side, which is where the emotion functions of the brain are stored. Now, most of the time, both sides of the brain are online and functioning, and they're working together, communicating, using both logic and emotion to keep us safe and regulated. But when something scary or overwhelming or traumatic happens, essentially the logic part of the brain shuts down. It goes offline. And the emotion side of the brain goes into overdrive. When this happens, because the two sides of the brain aren't communicating, memory isn't stored properly. Instead of being stored where it's supposed to, in the left side of the brain, it gets stored in the right side or the emotional side of the brain. And that's why when people think about a traumatic incident, even years, decades later, they often get flooded with those same emotions that they felt at the time of the incident because it's stored in the emotional side of the brain. So the goal of EMDR is pretty simple. We want the client to remember and reprocess the traumatic event while engaging both the left and the right sides of the brain. That way the memory can move from being incorrectly stored in the right side of the brain over to the left. When that happens, when the memory is properly stored in the left side of the brain, a person can think about the traumatic incident and not be flooded and completely dysregulated with those big, powerful emotions. So here's how we do it. We have a client target a specific part of the memory of the traumatic event. And while they're thinking about that event, the therapist is doing something called bilateral stimulation. And that's just a fancy way to say we're doing something to engage both sides of the brain. So the client is remembering, and both the left and the right sides of the brain are activated. And there's a few ways that we do bilateral stimulation. So kind of the original way, the therapist will put two fingers up in front of the client's face and move their hand back and forth, and then the client tracks the movement of the fingers with their eyes. This refers to the EM of EMDR, EM meaning eye movement. As the client's eyes move back and forth, we're actually engaging both the left and the right sides of the brain. And there are other ways to do bilateral stimulation too. Some therapists like to use noise, so a client will put in headphones and they'll hear tones or chimes, one ear at a time, one side at a time. And again, that's lighting up the left and the right side of the brain while the client is remembering the traumatic event. So another way that we do it now is with something called tappers, that's what therapists call them, where essentially the client will hold two little remotes, one in each hand, and they vibrate one side at a time. And then the therapist has a little control box linked to the remotes where we can set the speed and the intensity of the vibration. And again, holding the tappers as they vibrate one side at a time, we're firing up the left and the right side of the brain while the client is remembering the traumatic event. One of the cool things about EMDR is that it can be integrated really beautifully with play therapy, so it's a really effective treatment modality for kids who have experienced trauma. And now before we do the actual reprocessing, the therapist and the client are going to work together for a couple weeks or even months on something that we call resourcing. And that's basically a fancy way of saying the therapist is going to teach the client several different grounding and relaxation techniques and strategies that they can utilize during reprocessing if remembering the traumatic event becomes really overwhelming and a client either starts to have a panic attack or dissociate, kind of leave their body. We want our clients to have the tools to be able to do reprocessing safely We're not just going to throw you into remembering a really traumatic event without doing some prep work first. We have several therapists at Relate who are trained in EMDR, so if you think that this is a modality that could be helpful for you, I really encourage you to call our intake department and ask about setting up an appointment with an EMDR trained therapist.